closed session pursuant to Wisconsin statute section 19.851C to discuss performance evaluation data of public employees. And that will be at the end of, or toward the end of our meeting tonight. And item D is an approval of minutes. Can I have a motion to approve the minutes as listed in the agenda?
So moved.
Second. A motion and a second. Any discussion? All in favor say aye.
Aye.
Opposed? The ayes have it. And then moving on to E, new and previous matters, we have held items number 2, an ordinance to amend our ordinances.
Mr. Chair,
Go ahead, Alderman May.
is this to put on file? 2 and 3?
Mr. Chair,
Yes, please, Ms. Grill.
2, 3, and 4 are to be placed on file.
Excellent.
Okay.
Can I have a motion to place those on file?
So moved.
Second. I have a motion and a second. Any discussion? All in favor say aye.
Aye.
Opposed? Ayes have it. And IT director discussion items. Tony,
Can we approach?
please, come on up.
Mr. Chair.
Okay, I can approach.
So I am Tony Warkachewski, Director of the IT Department, and with me today is Joe Cliseri, newly hired Project Manager for the IT Department. I was in front of all of you, along with the members of the Public Works Committee back in December, where we told you that we were gonna take an approach to try to find a new software solution for the Department of Public Works that would do work order and asset management. Slight change of approach. I think prior to that, we were thinking we could develop something like that in-house. And what I told you last December was we were gonna put out to bid to try to find a software package to do that instead. And so we wanted to give you a brief update today on how that project's going, because there's gonna be some decisions that we make soon that have a financial impact. So what we're gonna show you today, real briefly, it's the same thing we showed the Public Works Committee last Thursday. So Joe, you wanna take it away?
Sure. So if you could, sorry, got it up on the screen
Is
there.
that the same as
Yep.
the one?
It is the
That's what you
same
emailed,
that's
though.
yep. So as Tony, I think, covered that, the project objective, pretty straightforward, hasn't changed as we've moved through the project, pretty generically stated. Right now, we are in contract negotiations, about to start legal review process. It matches our strategic goals in that we have taken, this is a draft, as you see, I put that up there 4 times, as we tried to map a bunch of these outcomes to the strategic goals, and we'll expand on that and refine that as we go forward. But just to show you all that we're moving in that direction. Some of the biggest benefits will really be around understanding where our costs are, so that we can make informed decisions on where to spend more or where to spend less. I know that's overly simplified, but it really can make a huge difference with so many assets. Cost estimates for the first 5 years. You can see the totals there. Year 1 would be abbreviated because we probably wouldn't start until August or September if things go to the current schedule. We look at coming back before the council, most likely at the July meeting. It's probably not going to happen for the June meeting. We did approach several vendors, got down to 2 finalists, had a scoring plan. It was a unanimous decision by all the core team members, which was myself, Robert Barwick, and members from the Public Works Department, and picked the best one. And I would tend to agree, although I didn't vote, I would tend to agree with their pick.
And their pick was?
Asset Works.
Asset Works. Project timeline moving forward, we'll come back, as I say, in July, and then implementation with planning would start in August and kick off somewhere at the end of August, early September. Next step, finalize the pricing terms and conditions, resolution and such, and then just begin the implementation. So matter just to keep you all up to date on what's going on. If there's any questions I can answer, I'd be happy to.
Yeah, and I think I'll start my concern, and thank you for bringing this to us, so and keeping us along here, and this is a needed thing. My concern is the price on this. This seems like a really big ticket item, and I think that IT, though, is doing what direction you got from us as the council of where it used to be that these things were tried to be done on the cheap in-house, where we're saying, well, maybe we should go out and find a proven vendor, a proven source, and utilize that. Why reinvent the wheel? Why try and do it ourselves? But then I think we're seeing that there's a big price involved in that. Can you just speak to that, discuss that a little bit more?
Yeah, it was kind of interesting as we went through we did interim scoring after we got a little bit of information or saw online demos and then saw live demos. Pretty much the scoring matched the cost until we got to the very end. And then the two of the middle ones came in as the ones you saw as finalists. So we ended up not picking the most expensive one. And we had what some thought was a overly significant amount of weight on the cost, 30%. But yet that didn't affect the overall score. And within 100 points, that difference of score is fairly significant, taking into consideration all the different criteria that we put in there. So I would say there's cheaper. One of the huge things was adaptability. You can spend 10,000, you can spend 10 million. If people don't use it, you're out either way. And that was a major concern of the core team, and I totally agree with that, because that would be a failure right there.
Mr. Chair?
Alderman May.
Yeah, I noticed the same thing with the pricing. It looked like the professional services is quite a bit. It looks like 275,000 within the first 2 years, and then it falls off. What are we getting for that professional service?
So that would be the configuration of the system. The system has to match, and the importing of our assets, the guidance that they would give us on what attributes to bring in from our assets, training, project management. I'm probably leaving off one other thing, but yeah, I mean, there's no doubt that's where they make some of their money.
The professional services to help us have a successful implementation. We haven't gone through yet the fine tooth comb of deciding exactly what that total cost is. We're in negotiations right now, so some of it, that spreadsheet looks pretty accurate, but I still think it's not a final price, right?
Right.
The fact that we have a project manager on site to help with the implementation might mean we don't need as much of that coming from the vendor. I think we still have a little bit of work to do on that.
And as a reminder, the asset management, that'll be like barcoding stop signs and things like that and everything too, right? So you can see from one scan when it was installed, who the manufacturer was, things like that.
Yep.
People can go out in the field, know what's next on their journey, whether at the beginning of the day, because they can plan out their route, or they can get their assignments while en route or out in the field via the mobile devices that almost all of them will have.
Mr. Chair, just to put a little perspective on things, also when we're working with BP Logics, we have that service option on our website for people to submit complaints and things through the website. We had utilized them to develop that for us, and just for that component, it was $20,000. So to implement a full system that's much more robust, it might seem like a large cost. However, there's a lot of components that we're going to be receiving and benefits we'll be getting from this system.
Alderman Weigel.
I'm going to ask my regular questions. Who else uses this product, particularly like in the neighborhood in southeastern Wisconsin? I guess I'd like to know where they're based. Asset Works, are they Silicon Valley?
Iowa.
Iowa? Okay.
And if I recalling it correctly, I know the salesman came from Iowa. So the county of Waukesha, Walworth County, city of Waukesha, either Racine or Kenosha, I'm sorry, I always get those two confused. City of Bismarck's right in the middle, or the beginning of their implementation. So they do have a fairly strong presence in the local area. Jim Liu, the fleet director, has a familiar or a professional relationship with the fleet manager out in Waukesha, and has been talking about this for years, and I guess they've been coming in here for quite a while time.
Any other discussion? All right. Hey, thank you.
You're welcome.
Thank you.
Appreciate the time.
All right, and then moving on to item 6, which is city administrator discussion items, the preliminary 2019 budget calendar.
This was attached to the agenda. There were 2 minor changes. In October, the publication will take place on October 17th instead of October 18th, and then the November council meeting is actually on the 7th, not the 6th, and I do need to change that in the middle too, so I'll update that for the council on Tuesday. So we're trying to incorporate both the budget calendar and the capital improvement calendar because they are very close related initiatives. We're also changing the way that we're working with departments to submit their budget. So in the past, it was set aside submit rules to the departments. They submitted the budget. Then the mayor and the finance director and myself would meet with the departments. Instead of doing the meeting at the end when it's a little difficult to make changes and things like that, we'll be meeting with them first before they put their budget documents together. So I was able to meet with some of the council members to get some input also on the budget. So thank you to those people that spoke with me on that. I don't know if there's any questions, or Peggy, did you have anything that you wanted to add? So it'll be before you on Tuesday. So.
All right. Keep going, Rebecca. You're on a roll.
Okay.
Number 7.
So the next item is some information on progress on the Medicare Advantage plan, and I don't know if Ryan and Jane can come on.
I'll attest for the city's standpoint, it's a well-oiled machine. Everything is progressing real well. They came in last week and presented 4 special meetings for the retirees, one of which was taped, so if you're interested in seeing the delivery and that, you can visit that out on a hidden site of the website. But it's been going well. I probably had just a handful of complaints, and it was more just unease about a change, so.
And I will say from the Horton.
And tell us who you are, please. For
Oh, I'm
anyone.
sorry.
Yeah, thank you.
Rand Beaudry from the Horton Group. I feel like we.
Yep, we do, but still want to make sure. Thank you.
Horton attended all 4 of the meetings as well, and since that those meetings, we've had about 7 phone calls in our offices, mainly about what tier is my prescription drug in. I'm getting a 90-day supply right now. What do I have to do to change that prescription up? Or if I need a prior authorization, or I'm taking more pills than it says that the quantities allowed. So hasn't been really complaints as much as it's just been seeking some additional information. One of the questions that we've been asked, and this is just for the committee's information, is if I'm actively at work and I'm Medicare eligible, would I be allowed to take this plan? So under the law, the city can't encourage people to go off the city's healthcare plan under the Medicare secondary payer rules, but certainly if someone wanted to do that, they would be eligible to go ahead and take themselves off the city's plan and go on a Medicare Advantage plan. And so taking a look at those benefits, if for example you are age 65, 66 and you're still considered an employee, but you're thinking, well, I'm not sure if this would be a more cost-effective alternative for me, you are absolutely allowed to do that. So if anybody wants to do that, we would encourage them to take a look at the link that is the presentation and discuss that with Horton. We can certainly have them opt in if they'd like, recognizing that for the medical side there are no deductibles, there's no co-insurance, and there's no co-payments. So the only co-payment that comes into play is for prescription drugs, and you can see any provider that takes Medicare and is willing to bill Humana, so it opens up. So if you're on the Blue Priority Plan as an example and you'd like to go back to Freighter or Pro Health, that's an opportunity. So a couple people just asked about that. They were very excited to hear some great things about the plan, and it's something to kind of keep in mind. But we think it's been going well, and I'm, along with Jane, we have not personally heard complaints other than my prescriptions are going to cost me more than $3 now. So that was the biggest one from retirees that are retired prior to 2010.
Okay, thank you. Any other discussion on that item? All right, then moving on, Rebecca.
Okay. Number 8, I have passed out a packet of regarding the total benefit package. The Employee Benefit Committee has been busy over the past several months putting together, reviewing and putting together a proposed total benefit package for your consideration. 2 members of this committee are on that committee also. It's somewhat complex and has a lot of moving parts in it, so we just wanted to bring it to the committee tonight as a first discussion and information, providing information to the committee. So there's a lot of details that are not included in here. I'd be happy to meet with any one of you that might have questions, that want to sit down and go into things a little deeper, but the purpose tonight is just really to go over the different components and everyone have a first view at what we've been putting together. So I'll just go through the packet. So I think everyone has, Tony, you have another copy? So
It's not available.
it is, if you want
Yeah.
me to pull it up there, I can do so. Would you prefer me to do it on screen?
Yeah.
People who
Can
may
you
be
do it
watching later.
real quick?
Sure.
Real quick ones.
Real quick ones. Yeah. Dare hey.
Got that from the Manitowoc Minute guy. Yeah.
On business. Okay. Now I'm turned off.
Hey, we got an IT guy.
Yeah, that's right.
Yeah,
I think it might have turned off.
Yeah.
yeah, what's Lynn's
But here
phone
we go.
number?
That's my password too. ...
Yours? Really? I'm changing mine.
So as we're waiting for this to boot up, the total benefit package, there's a variety of different components that this encompasses. It includes compensation. Now last year we went through the classification and compensation study. So what we're presenting tonight does not include anything, adjustments to salary. So we have the class comp and then the pay for performance that we're just rolling out to. The components that we're talking about tonight will mostly be all of the other ones. Insurance, that includes health, dental. We're recommending a vision option, employee paid vision option, and then a long-term disability policy under the insurance. And then time off benefits, we'll be talking about time off bank, which includes vacation, sick leave, and random holidays together. We'll get more into that as we go through. I have it open in my... And then pension, there's no adjustments to that. That remains the same. We have a few adjustments to the miscellaneous and voluntary benefits, and then educational assistance that has to do with tuition reimbursement and tuition repayment options. So we'll get into that. The Employee Benefit Committee was tasked with these two items, developing recommendations for retiree health insurance, and then develop a paid time off benefit plan. So earlier this year, we did a survey of employees, I believe 315 or 18 participated. And one of the questions had to do with paid time off components. And so there were some themes that came through. This is the overall theme. Paid time off is a bad idea. We need an emergency bank. Paid time off, I need more information. More time for new employees at start. Credit for sick leave, deal with sick leave abuse. And the next several slides are just comments from the survey.
What would be giving new hires?
What would
I
we,
mean, if you go back, it's like new employees that need more time
more time?
at start. What are we talking about?
It's all in here.
Oh, it's all in here?
I mean,
We'll get,
We'll get there.
the
Okay.
details will be coming
Okay,
shortly.
okay.
yeah.
So here's, and I just cut and paste, so I'm not gonna take credit for any of the spelling errors or misuse of words, but here's just, I won't read them, they're just here provided for you to go through at some point should you wish to do so. So we tried to include these thought themes from the employee survey when we were putting together the program. So this is an initial overview of the components. I'll go in a little more detail as we get further into the presentation. So the idea is that people can either choose to remain in the legacy benefit package, or they can move into the total benefit package. And what I'm going to be talking about mostly tonight is what's part of the total benefit package. So the only two exceptions to that are the first two listed here. We are recommending that the city purchase a long-term disability policy for all employees that starts at 90 calendar days, and then for those in the total benefit package, they would have an extended sick leave benefit to bridge the gap up to the 90 days. Those who would be in the legacy benefit, they do either have a sick leave accrual balance, or some people are on the long-term sick policy where they cannot have up to 52 weeks with full pay. The other part that would apply to all employees that we're recommending is changing from having 8 scheduled city holidays, changing that to 9, adding Martin Luther King Jr. Day, and then reducing the random holiday that we currently have from 4 to 3. So that would be for all employees. The next parts of this just have to do with people who would choose to be part of the total benefit package, or new employees hired after a certain date, August 1st, September 1st, whatever date is chosen. So retiree healthcare, we would provide up to 10 years or at Medicare, Medicaid, Title 19 eligibility. The thought process there is many employees are eligible for retirement at age 55. That would bridge the gap to age 65, the current Medicare age. That allow participation in the city-sponsored Medicare offering at full cost, similar to what Rain had mentioned before. If people wanted to opt in to that, we would allow them to do that. Time off bank with extended sick leave. We'll get a little more into that later. The long-term disability policy provides a true safety net. The jury duty and military service, those are current existing benefits. greater than 3-day events for bereavement leave, city-sponsored employee paid vision, lateral time off benefit conversion. That would mean people that have had prior municipal service at a different municipality, in order to incentivize people to move from the legacy benefit package to the total benefit package. We'd give them some lateral time off up to 10 years, and it's a 1 for 2, and I'll go into that a little bit more when I get to the further into the presentation. And then extended sick leave bonus for retiree healthcare contribution. What that means is there's an extended sick leave bank under this proposed program, which has a maximum accrual of 720 hours. If a person who's going to retire retires with 680 hours, so that's 40 hours less, the recommendation is that they would be able to have active premium and rate levels for 3 years, 36 months after they retire. Another incentive for people to move over to the program, but also to counteract, sometimes there's might be a few employees that take off the last several years of their employment to get every part of their body fixed, and this might incentivize them to do that when they retire instead of while they're working, because that is pretty challenging to manage departments when especially if you have a smaller department. If you have 50% or 25% of your staff gone, it's pretty difficult to work.
Getting new knees.
Right.
3 times.
3 times.
Wow.
So, and the last part has to do with adjusting the tuition reimbursement and then adding a tuition repayment. So here's some positives regarding the total benefits package with a time off bank and extended sick leave bank. We have a competitive advantage in recruiting retention. With the new employees, a newer employee has a few more days at the beginning. Right now, an employee doesn't get, they get 10 days after 1 year of service. This would give them more time at the beginning, and I'll get to how much time that is. Meets the needs of a diverse workforce, so depending upon people's age or where they are in their career, they might need different time off and have different needs. So this gives them more flexibility, rewards desired behavior, people that come to work every day. It's more equitable to them. Doesn't challenge employees' integrity. That means they don't have to lie that they're sick, which sometimes people will do, because currently people get 15 days of sick leave every year, and some of them believe that they need to take those even when they're not sick. Also, there's some occasions where people are taking sick leave where they may not be sick, but their spouse or their children are sick, and our current sick leave policy does not allow use for that. Ease of administration, so as a manager, having people, it's just time off. It's not sick leave, it's not vacation. They don't have to call and cough and pretend that they're sick, and so makes it much more easy for scheduling and predictability if you know ahead of time when people are going to be sick, and reduces the unscheduled absences.
So the unscheduled will come because
they might be
somebody will
sick.
say, I'm taking, well, no, they'll say, instead of having to call in and cough to go to their brother-in-law's wedding or something, they'll just say, I'm taking off next Friday to go to a wedding.
We'll put into place that they have to let a certain time in advance. They can't just call up that morning. I mean, it could work,
Yeah,
but
it could.
but you want, depending upon the department, you might need advance notice. So if there's only 2 people in the department, it would be kind of complicated if they do it at the last minute. Provides privacy for employees. They don't have to share what their illness may be. It's a challenge for our accrual system, and then employees are more engaged at work since they can take the time off they need for the personal reasons. So those are some of the positives. Some of the negatives, perception, fear of losing benefits. Consistently in the survey, people said, I'm going to lose all my sick leave time, my earned sick leave time. I'm going to have less time off, things like that. There's been a lot of experiences that I think people have heard where some organizations had just implemented a one-size-fit-all for all of their employees. Like everyone just gets 25 days off, period, regardless of whether they have 1 year of experience or 25 years of experience. That's not our recommendation here. Fear of the unknown. They don't understand the plan. We're going to be, if we're given a go ahead with these things, we'll be talking with employees, explaining this, coming back to the committee to explain, because I know this first time it's going to be a little challenging to understand how it all fits together, because like I said before, there's a lot of pieces. Employees are unaccountable. Tracking of FMLA might be challenging. Presenteeism, people coming to work ill, and then employee planning risks if they view their entire time off as vacation time. So we do have some safeguards in there. If they use all their time and then they get sick, we only allow up to 40 hours unpaid, and then they would likely be terminated unless they were eligible for FMLA. So people need to take responsibility to plan and save, have a little bank. So the benefit package, as I mentioned before, for new employees on and after August 1st, I'm just being pretty ambitious saying that date. It could probably be September or October should the council choose to move forward. Current employees who choose to opt in, we would likely give them probably 60 days or something to decide whether they want to opt in. They can't choose to go back and forth. Once they're in, they're in. New options, except the ones that I noted, are only for the new employees and existing employees that opt in. So the time off bank with the extended sick leave benefit includes vacation, random holidays, normal sick occurrences, emergency leave, short-term bereavement leave, extended sick leave bank, and then it partners with the long-term disability. So, and I don't have this as part of the slide, but it's on the back of your packet. There's 4 examples of how this would look for employees. So the first one,
Can you tell us what page that looks like?
I don't have numbers,
Okay.
but it has a heading that says new employee,
Got
and
color bars on them.
Okay.
correct, it has the blue color bar, and the paging didn't work so well, but I'll walk through it with you. So tried to put this as a comparison. So the legacy benefit is on the left side, the total benefit package is on the right side. And I going back to the components that I mentioned at the beginning, the first was compensation. As I said, salary and pay for performance, those have already been dealt with, so there's no change to that. The insurance, The premium shares of 10 and 20%, we're not recommending any changes to that. Retiree healthcare eligibility and duration. This is where the first change comes in, and tried to color code this. Red could be perceived as a negative, green as a positive, and black is the same. So right now, employees hired after 4/1/08, after 15 years of continuous service, they get retiree health care, which ceases upon obtaining Medicare, Medicaid, or Title 19 eligibility. So the recommendation is to instead add a coverage ceases after 10 years or the Medicare eligibility. But
No, why would that be seen as a negative? In some ways, I see it as a positive. If you're in police and fire, you don't want to stick it out for. Is it because it ceases after 10 years?
correct. So if you're police and fire right now, you can retire when you're 50, so
Gotcha.
that they wouldn't have the full 15 years.
Okay.
So now if I were doing this for the city benefit, it would be in green because it's a limit of 10 years. And the next part is retirees are permitted to remain on the Medicare offering after 10 years. When they become, if the city has a Medicare offering, retirees can be part of it if they pay the full cost. It's not going to have any effect on our rates for that. Retiree benefit levels, they would be the same. The rate calculation, for the new employee, we're recommending, and this is a little different than what we came from the committee, but talking with Peggy and trying to be sustainable for long-term for the city, we're recommending that the retirees would pay 35% of the total monthly cost of the retiree rates. When we get to the other examples, you'll see that number be 20, and that's to incentivize those employees to move from the legacy benefit to the total benefit package. Credit for sick leave, extended sick leave bank bonus, as I mentioned before, if people that have a balance in their extended sick leave bank would be eligible to pay the same rate and premium share as actives for 36 months after they retire. That gives a little bit flexibility in case someone would be sick for a week or something, upon retirement, but it also limits the people being out for months and months at a time right before retirement. Spouse and dependent coverage remains the same. Ability to return to retiree healthcare plan, that remains the same. Once they leave, they can't return. This is new for all employees, the one plan per family for health and dental. If an employee is married to another employee, they can only have, effective March 1st, 2019, they can only have one health or dental plan. Currently, some employees have 2 medical plans. There's more that have 2 dental plans. So we would recommend that for the dental plan, if they wanted to have the second one, they would bear the full cost of that second plan if they wanted to. For the dental, when its coverage is effective, instead of being after 6 months, it would be after 30 days. That's a recruitment tool. Vision, this is a new component for the city. This is offering vision insurance at the employee's cost. Examples would be like $150 yearly allowance per person for glasses or contacts or something like that. The health insurance will still cover the annual eye exam. Disability insurance, this will be new for all employees. coverage provides 66% of salary coverage after 90 days up to age 65. The time off bank, extended sick leave bank, and negative balance would provide the coverage up to the 90 days and the full salary differential. We are recommending that disability insurance for all employees, and even if we don't go forward with the total benefit package, we are recommending going forward with the long-term disability program, and we'll talk about that a little bit more under the next item. Life insurance remains the same, and that goes to the next page, and then we got cut off inappropriately, so move on to the next one, which talks about the time off benefits for the new employee. So right now, vacation and sick leave are included, are shown together under the legacy portion, and then under the total benefit package, you have time off with extended sick leave bank. Currently, after 1 year of service, an employee gets 10 days, very generous program, 10 days of vacation. With the total benefit package, we're recommending that each month they would accrue 16.67 hours of time off. It's 25 per year, 200 hours per year. They would have a time off bank that has a maximum amount that they can accrue of 200 hours. That there would be a negative time off bank of 40 hours max. So if someone needed to go negative, if they didn't have enough, if they're a new employee and they've just been here 3 months and they needed to be off more than, if they needed to be off 40 hours, they could borrow. Like if they had a vacation plan before we hired them, they could be paid for that. Sick leave is included in the time off bank. So right now, an employee is allocated 15 sick days a year, 10 hours a month, 120 hours per year. Total accumulation not to exceed 2080 hours or a maximum of 1 year. So that's one of the significant changes, is the sick leave is not separate under the time off bank. With the time off bank, and in order to get people up to meet the 90 days for the long-term disability, there's an extended sick leave bank that's part of that. People, if they don't use 25 days per year, which if people are planning appropriately, they wouldn't, because they would want to save some time for an emergency. This allows them to move up to 25 days per year into that extended sick leave, kind of as an emergency safety net for them to go up to the 90 days. There's an incentive for people planning ahead, so not calling in at the last minute saying, I'm not coming today. We're recommending that they would get maybe 1 extra day of time per year if they only have 2 or less of those events. And then at retirement, if they have 680 hours in their sick leave bank, their premium share and rate would be equivalent to the active for 36 months. And then the extended sick leave bank could be used also for their family sick events. Right now, employees cannot use their sick leave for taking care of their spouse or children. That's kind of a big confusing part. So if you need more detail or have questions.
Yeah. As I've said in our meetings, I think when we give this to the employees, we're going to have to find a way to break this down into simple terms, give them the detail, but break it down.
Yeah.
Because this is, I get it because I've been through it 3 or 4 times now with the committee and here, but this is a lot to process. So.
Mr. Chair.
Alderman Weigel?
Rebecca, so I see sometimes we use the term at retirement, and then other times we use the term at termination. That's two separate things, right? Does retirement necessarily mean somebody's hit age 65?
No,
No.
they could be 55 or 50,
Or
depending
just so
on.
retire? So when it says up in the sick leave at retirement of 680 hours and extended leave, that doesn't necessarily mean that they have to be retiring. They could just be leaving employment with the city.
No, we're saying they actually have to be retiring under
For
WRS
that.
to get that.
Okay. So when the word retirement is used, it specifically means retirement.
Correct.
Okay.
And so when you see the time off balance paid out at termination,
That could
that's
be what,
anything.
yeah.
Right now that exists, so if you have a balance in your vacation, if you terminate employment, whether we choose to terminate or you choose to terminate,
Yeah, you still get
we,
paid out.
we still pay those
Yeah.
things out, so that's not really a change for that. And with a little bit more on the timeout, we, added that those people who, if you put it in your policy that people have to leave in good standing and with proper notice, then you don't have to pay out if you choose to terminate.
Oh, they're not leaving in good standing.
And if they don't give you like 2 weeks notice, or in the case of the executive service employees, we are required to give 60 days notice. If we don't do that, then if we include that in the policy, then we wouldn't be paying out that time. We don't have that now, which is somewhat of a challenge. So, the holidays, as I mentioned before, the 9 paid holidays, that changes one of the random holidays into a scheduled time off for MLK Junior Day. For the time off, for the total benefit package, the random holidays are included in the time off bank. Bereavement leave, it's an expansion of the funeral leave and adjustment of that. So when someone's lost a spouse or a child, typically there's more than just dealing with the funeral, which is going to take more than 5 days. So this recognizes that. It's consistent with what other organizations are doing. And then for currently people would have 3 days or 1 days for these people listed. We're saying that that's part of the time off bank. Then we don't have to get into the detail of, is that your grandma, is that your cousin, that whoever, it's just that eliminates that. We're also recommending that we allow for donations for bereavement leave under the donation of time program. So sometimes employees might be new to city service, they might not have a lot of time, and they might go through some catastrophic health event and then go through a challenging death in their family, and this would allow another employee to donate a certain amount of time. We have a limit, I think it's 120 days that'll be coming up. Yeah, it's the next one, 120 hours of time.
You don't want to do the negative bank instead? No?
Well, they possibly could do that
Oh, they could do
too.
that. Okay.
Yeah. It's just, we're trying to do the total
Right.
package, so to protect people in different circumstances. So the donation of time changes from 80 to 120 hours. Then the voluntary time off, there's a typo, up to 40 hours per year instead of just an unlimited time off. So this is where you would curb those people that think that their time off, they get the 25 days, they can just take it off and go. I mean, if they do that, they're at risk for us terminating the relationship. Armed services training and jury duty are the same, pension's the same. tuition reimbursement adjustment. Right now, people can get up to $1,000 per calendar year for academic degree. We're recommending 50% up to $1,500 per year with a maximum of $45 per employee. So people can't be professional students if they're employees here. This is just to cover a certain amount of time. And then the next, and I apologize for the spacing again, the next is a recruitment tool, tuition repayment. We're recommending that we allow $75 per month or $90 per year, max per employee of $2,700. You can't get tuition reimbursement and tuition repayment in the same year, and you can't get tuition repayment for what we reimbursed you for.
What?
So, that is taxable, so toyed with making it $50, but then that would essentially be $37, so at 75, it's probably around 50. So, so that's for a 1-year employee. The next example is for a 10-year employee and prior to 4/1/08. The reason why that date is significant is that's the date and around there for different unions and represented. That's the date where the lifetime retiree health care was eliminated. So on and after 4/1/08, if you started here, you only get it till you're Medicare eligible. Before that time, you get it for you and your spouse and dependents have lifetime coverage.
And dependents.
And dependents. So, a lot of this is the same. The colors change a little bit because, so under the retiree healthcare eligibility and duration, retirees are permitted to remain on the Medicare offering. Well, that could be seen as a positive or a negative. Right now, they can be in the lifetime benefit, but it might cost them significantly more to pay the premium share. I'm not sure. It depends on when they retire and things like that. So, the benefit levels, same as the legacy benefit for actives. Here's where you, and then rate calculations. Here's where we have the 20% instead of the 35% to incentivize the movement. Extended sick leave bank, the spouse and dependent coverage, that's in red also because as we pointed out, they would have lifetime coverage for those people. Everything else is pretty much the same. If you go to the time off benefits, right now they're earning 16 days of vacation per year, 128 hours. The recommendation would be that they would get 20 hours of time off accrued per month, 30 per year, 240 hours per year. Then we had recommending adjusting the time off bank to a maximum of 240 hours. So those are the differences for the 10-year employee. Any questions on that? Okay. So the 10-year employee after 4108 is in green, and there's more green on this because they do not have the post-65 retirement health care. So, also recommending they would be allowed to participate at 20% of the total cost. Everything else is the same as the other tenure employee. Okay. So then the 25 plus, we have 65 employees that are not, this doesn't include the represented. So this is red because there's a little bit more red. So they get the retire healthcare after 10 years for themselves and their spouse and dependents
Under the legacy.
under the legacy plan. Yes. So everything else for the total benefit package is pretty much is consistent up into the time off portion. So under the legacy benefit, they receive 28 days of vacation, 224 hours per year. The carryover is the same, no negative balance. If they've been here for 25 years plus, they would be eligible for full pay up to 52 weeks for the sick leave. So under the total benefit package, the recommendation is that they would accrue 26.67 hours per month, which equals 40 days per year, and 320 hours per year. The time off bank is adjusted to 320 hours for that. Everything else remains the same as the other recommendations. So that's just a real quick overview of how it would affect those other employees, and we'll continue to try to make it a little more simple. Because it is somewhat complicated. So going back, does anyone have any questions?
Sure, have at it.
This is really confusing stuff, so I just wanna clarify to your point, Alderman Weigel, in regards to the dependents covered for life. If you're classified as a child, you age off the plan at age
No, yeah,
26,
yeah,
right?
yeah, I get that.
Obviously, the plan has provisions if you're disabled and
Yeah,
what you
it
can
would
do.
only be if you were
So they do fall off eventually, but truly, if the retiree were to pass away, the spouse would continue on depending on the date that the
Yeah.
person was hired.
Or if the retiree had children late in life.
That would be for our older retirees, yes, you're absolutely right, and we could potentially, we never advertise that, but you know,
Okay, tell everybody.
could potentially if we,
Thanks, Jane. Yeah, and thanks to everyone on this committee that put this together. This is really thorough. Thank you. Go ahead, Rebecca.
Sure. So just a few more slides. So the next step is we're seeking input from employees, elected officials, police and fire commission, the library board. Then we would be creating policies, and then we'll be having employee benefit committee meetings on June 26th, August 6th, and September 14th, and then we would likely be talking about this with Administration and Finance Committee and the Common Council on the next at least 3 meetings.
Okay. Any-
And the last slide, other things we would still need to do after we deal with it, after we take care of the total benefit package, we would still need to look at something with the retiree healthcare. The pre-65 retirees, we've been doing weighted increases for the premium shares. That would be something that we might need to continue looking at with the committee. Look into our health and dental insurance offerings and the plan designs, you know, something like the deductibles or things like that. Right now we currently have a $100 and $300 we'll be talking a little bit about the wellness program and looking into some other flexibility for work-life balance as the workforce is changing, different demands are coming from the employees, and a little more flexibility as far as ability to perhaps work from home on occasion or things like that. So we'll be talking with the committee going forward on those things. So thank you, and if you want to sit down, and I have lots of other charts, and we're working on costing. It's pretty challenging to do. There's a lot of things we can't assume and things we can, and so we're just trying to work those out. So the overall feeling, though, is that this is not going to be costing more. It's perhaps cost neutral to the city. Right? I mean,
I think it's hard because you have to value people coming to work. You know, right now we're spending about $600,000 a year in sick and FMLA benefits that perhaps, I mean, some of them can't be avoided, but even saving 20% of that could really move the needle a lot as far as the budget goes, and we could get a lot more productivity out of the employees. So some of them will be dollar value, some of them will be time value.
All right, thank you. Any other discussion? Oh,
I was going to mention that going into this, our plan or our goal was to provide better or equal overall benefits at equal or less cost. And so it's been quite a discussion, pretty challenging committee going through all this stuff, but it is very complex. I think every one of our meetings is about 2 hours long at least. We never quite cover everything, but not in one sitting anyway. But it's really interesting how it comes together. And like you said, it's the productivity where we gain. So, and then having the long-term disability, a third party administers that, so they can decide whether you're still eligible or not, or whether it's time to get back to work rather than the city having to do that. It looks like we'll gain out of productivity. So,
Anyone else?
so that's a good segue into number 9.
All right.
Thank you.
Long-term disability program options. I don't know, Wayne, if you wanna come up here.
Good evening again, Rayanne Beaudry from the Horton Group. We have been marketing the long-term disability program for the city of West Allis, and as you might have heard earlier in the presentation, we are recommending that the city implement this for all active employees that are on a sick leave or a potential sick leave bank. And there's a lot of reasons for that. Number one is we do have this third party, which would be an outside source that would be along with the employee's physician, determining whether or not an employee needs to be out of work for an extended period of time. Long-term disability does integrate with workers' comp, so this also gives you another party review to say, yep, the person out on workers' comp is fit for light duty, isn't fit for light duty. The carrier we've selected, or that we're going to be recommending when we move toward this, is Reliance Standard. We've moved from National Insurance Services for 2 reasons. One is that Reliance Standard does not have the requirement that someone suffer an earnings loss. And the reason that that's important is that if the city wanted to pay someone the other third of their salary and make them take a sick day, they could make 100% of their pre-disability earnings while having the long-term disability carrier be paying 2/3, the city paying 1/3. They would use a day out of their sick leave bank, but they would be made whole while they were unable to work. You can't make more than your pre-disability earnings, but you could do that. The second reason that we have selected Reliance Standard is that they also have the ability to pay long-term disability benefits on a bi-weekly basis instead of monthly, which is the usual standard. The reason that's important is because the police and fire have in their contracts a bi-weekly payroll schedule. So to get over the hump of having them have to wait a month and have a discussion or have to negotiate that or buy it, we asked them if they would have the ability to administer paying these benefits on a bi-weekly basis so that people would be paid. on a regular basis, and they can do that. So there's a lot of other things. You don't have to be totally disabled during the 90-day elimination period. You have to be unable to perform one of the material duties of your job on a full-time basis. So for example, I use the easy example of I answer the phones for the city, and I get throat cancer. For some period of time, that's not going to be my forte. So I might be a great computer programmer. I might be able to do all of that other stuff, but my job, a material duty of my job would be to answer phones. I would be considered disabled, even if I was not out full time. The other is it's called 0-day residual. So from the first day of that your doctor certifies that you're disabled, that starts to count towards your elimination period. So even if I'm working part-time, I don't have to have an earnings loss. And so these are really important contractual provisions. The reason that we think that this is going to be a tremendous cost savings to the city is Peggy's already talked about $600,000 in FMLA benefits and sick leave. Truly, if someone is out for a year, we ought to really be able to monitor that. Everyone's going to blow through a sick leave bank, even those legacy employees, if they have a bad cancer, something else goes wrong, it's a bad car accident. This program will pay until Social Security normal retirement age. Right now that's 65, but it may not be forever. It's certainly not for me. I know I have to work till I'm 67 and a half to get full Social Security normal retirement benefits. And if I am actively at work past 65, I am guaranteed a minimum of 12 months of payment from the disability carrier. So I believe between the city paying 1/3 or in workers' comp pays 2/3, and then the LTD benefit would pay that other third. The city would have to pay nothing. So workers' comp people are going to be protected for a long time if that's what it takes, as well as those people that may have really significant issues. The one downfall for this is that, of course, if the city allows people to use their sick time for the serious illness of a family member, that is not true of the long-term disability plan. That is only for the employees because it is a income protection program. We want to keep you informed of this. We have had the rates quoted, and the committee has heard it's approximately $112,000 charge to put everyone on. We believe that will be a tremendous offset to the city and will save more than that. But I know that there will be more cost items that we'll be discussing in future meetings. If we go past, a September 1st effective date, they may choose to re-rate. It could change by a penny or two. It's not going to be significant, but as our census changes, as people get older, then obviously that's a challenge, and people that are already out pre-policy don't get to hop on. So that as time goes on, that savings could either grow or deteriorate depending upon what the city's current list of people are that are out on workers' comp or out on long-term sick leave plans or whatever the case might be. But we're really all for this, and we feel it'll be a significant cost savings to the city.
Great. Any questions? All right. Excellent. Thank you.
Wellness. All right. Last, I just wanted to keep the committee informed about what we're doing with regard to the wellness program. Currently, the city initiative, and I'll certainly ask Jane to comment if I screw up on this, but we have a health risk assessment and a biometric screen, and then the city has been doing various programs that they have been tracking and initiating on their own. You see the bucket list behind you. There have been some city initiatives through West Allis, things where people can get points. We did the Maintain Net Gain. All of those things have been pretty much done and tracked by HR. So what we've been looking at, just to kind of keep you informed, is we want to look at the value that we're getting for those health risk assessments and the biometric screens to make sure that they're in keeping, the values and the things that we get are in keeping with the city's goals as we move forward. And also what kind of a reward program might we be able to put in place that's cost effective and that would be tracked by an outside third party so that the rewards are measurable. They're something that are allocated evenly and distributed evenly, and also that get people to do the right thing. So for example, we would be rewarding people for getting their annual physical, their annual eye exam, their annual dental exam. There'd be some upload of points for that. And as they attain a certain color status, then potentially we'd be negotiating the future different premium contributions based on how well they performed under a wellness program. So we're kind of looking at that, because while we might love at Horton to be recommending a really hardcore outcomes-based program that control healthcare costs in the long run, quite frankly, I think at this point in time, we need to master some other goals for the city, which are increasing employee morale, getting them engaged in a program, and quite honestly, having the tracking not be necessarily done in HR. We want to get all employees engaged on a little bit more robust basis and make sure that whatever dollars the city is spending toward wellness are being used appropriately and are contributing to savings overall. So just wanted to, again, keep you informed. We're working with some vendors right now. By the next time we meet with you, we should have some basic costs for your consideration.
All right, sounds good. Anything else from the committee? Sure. Alderman Weigel.
We added spousal health risk assessments. What about dependent health risk assessments? Are other people doing that at all?
You
No,
can't.
you can't.
It's illegal.
Oh, okay, never
Yeah,
mind that.
unfortunately, under GINA, you can't ask dependent children for any of their health information.
Even if they're over age 18?
Especially if they're over age 18.
Oh, okay, never mind then. Edit that out of this.
I didn't know that until
It's
I
a
decided-
very common
I'm
question,
glad you asked.
and people, it doesn't seem to make any sense. We're paying for their health care. You're not getting that sophisticated of information from a health risk assessment. It's kind of pretty much global, but yes, when the Affordable Care Act came in, this was a piece of that just said, yeah, you can't ask kids any questions.
Yeah, it's the Genetic Information Non-Discrimination Act. It's saying that person's over age 18, what am I using that genetic information for, or that health information? And the federal government will not allow us to collect that information.
I understand for minors, I guess.
All right, thank you. Yeah, anything else before I said thank you, but anything else? All right, now thank you. All right, and then we ready to,
I do have
Go
one
ahead,
question.
Alderman May.
Is it gonna come back to here again before it goes to employees? The information, can we see the presentation before it goes to employees?
We certainly could bring it back next Tuesday if you wanted at the recess meeting, or unless you wanna meet before.
I'd just be curious to see what's gonna be presented to employees.
How long is the presentation gonna be?
I'm not saying it has to be given to us, I'd like
Well,
to see the presentation,
yeah.
yeah.
Oh, the employee presentation?
Yeah.
So, my intention was, I've been trying to go quarterly and do kind of office hours with employees. I was going to have this quarter office hours, like the first 15 minutes to 30 minutes at each of the locations, just be an overview, and then just question and answer session. So,
So you're not gonna get deep in the weeds with, you get 240 hours and you get 320 hours.
if an employee wants to talk about that after, I would sit down and do that with them, but I don't know how significantly different my presentation to them would be than what
Mhm.
was given before.
So you're gonna go through the examples of new hires, 10-year hires, and
Yeah.
you're gonna go through all that.
Yeah, I mean, and like I said before, there's more charts, but I think if you start with those, it's more confusing. I think I talked to Alderman Haas and Alderman Lysak about that today, and I started with those charts, and it was a little more confusing. So, and I wasn't getting my point across very well that way, because it's just a lot of information. So I don't know if you have suggestions of how. I tried to simplify, but we also want to include enough information at the beginning. So I don't know what your thought process is for.
My concern is if something is confusing, it is automatically bad in some people's minds. And I think if we truly want to get people to go over to the newer program, we need to find a way to break that information down in simplistic terms
So
or simplistic means. And I'm not sure what that would look like. And I'm going back to when Act 10 came in and we had remember the binder we had full of information. Here's what changed. And I'm not saying we have to complete a binder, but it would be good to have that detailed information available somewhere where they could go and see it. So I think it's a good plan. I'm just afraid people will look at it, see it change, and go, "Oh, it's too baffling. I'm not going to do it."
So from my perspective, I think it's good if I can just go and talk one-on-one, because when I've talked to people about things, it's totally different than the telephone that they've heard from this person to that person. I mean, we've taken away children and killed people over the years.
Really?
So yeah. So just having that more personal
So
dialogue.
these are one-on-one meetings. These aren't
Yeah, I mean
standing in
sometimes
front of a
there
group of 50 employees.
sometimes there might be 15 people, or sometimes people come armed with their questions, which is totally fine. That's why I'm there to answer it. So yeah, it's not, I think starting from that level, and then maybe if we need to have a bigger employee meeting where we cover where if there's questions that people are consistently having, and we can create an FAQ and things like that. I just, from where I'm coming from, I've looked at it too much for 5 months. So I need,
I know that happens. Yeah, you get innately so connected, you start
Trees,
speaking in terms,
forest.
and people go, "What?"
yeah,
Right.
so I'm trying to break it down to the level, but if there's something that is missing or is not obvious, we'll put together FAQs and things like that for the employees. I think we learned a lot from the different type of initiatives that we've done, and just communicating on a personal level has been helpful with different things. I think with the pay for performance and things like that, likely I'll be sitting down with executive leadership team too and talking through with them, because they'll be dialoguing with their employees about things and helping them answer questions. So
Okay. The
I
idea
don't
is
know.
to have something back to us by October, let's say,
I would hope that it would be
sooner.
sooner than that. It may be the July meeting.
And that'd be all the policy changes and everything.
So there's going into policies. The city has a significant number of policies, probably more than many other organizations. So there's probably some room for streamlining that process. So we're gonna leave the legacy, right? Because not everyone's gonna change. I know that. So we would just create something new and
Parallel.
streamlined, probably called the total benefit package, which would
Period.
have,
Yeah. So we could be living with legacy. People could be opting to stay in the legacy another 35 years.
Probably not.
Okay, I understand.
The 10-year mark, that pre and post Medicare eligibility is really gonna be a driver.
Okay.
That's probably the biggest thing.
Well-
People with less than 10 years in don't really have a lot of incentive to stay in the legacy plan.
I understand the difficulty of trying to create something that's fair to everyone, but still incentivize them. You guys have done a ton of work here. I applaud everybody on that committee, because it can't have been easy. Finding the benchmarks for the numbers wherever it is. I hope it works out. I guess we really won't know for 20 years, though, right?
well,
We'll know real quickly how much that we're saving money.
we should know something by whatever date we set for
Yeah.
people to transition.
Uh-huh.
So for current employees, if you say November 1st or December 1st, then we'll have a significant idea by then, because we'll be stopping everything for those people, and then for new people, we'll be
Yeah.
stopping
Yeah.
that.
One thing that does concern me is the idea that we're going to make people make a choice, and they have a couple months to make that choice, and then they're married to that choice. And I understand we don't want people jumping back and forth, but I guess I'd like to see it's a complex system that we're talking about here, and some people may not understand. I mean, I guess you really wouldn't know. I mean, you don't want to leave it forever, but if you gave them like 6 months if they opted to go back to the legacy, I guess. I guess that'd be the one. And I mean, I understand it's going to add a level of difficulty to the whole process. Yeah, I guess it would be a real difficult thing to let them come back.
I actually think you'll have fewer people opting in until the second year. They'll let some other people experiment with
Oh,
it.
okay, yeah. Let somebody else test the waters.
Yeah, this is an open enrollment. There's a one-time switch.
Oh no, that's right. They're only going to have a couple months to switch.
Well, we could set the amount of time to switch, right?
The challenge would be you want to start it at the beginning of a calendar year, because we're talking about accruals, and when we in the legacy plan, people get their vacation. What the people before 1109 or something, they get their allocation at the beginning of the year. So
So we want to give them that choice. I think you said like November, so that you have 1 month to kind of get it set up, so you're ready to go day one,
January 1st.
right, and we would be available to talk. Obviously, they have to make the decision for themselves, but to provide examples of what it looks like.
You're going to have a very busy, whatever month we decide to make that, or 2 months we decide to make that.
When the budget gets adopted.
Yeah, it's the same time. It's the same time. It's the Christmas, the Thanksgiving, Christmas holidays. I understand that.
And no plans.
No deer hunting for you this
No.
week.
All right, any further discussion on these issues before we go into closed session? All right, thank you, everybody. Please take notice that the Administration and Finance Committee of the City of West Allis will meet at approximately 6 p.m. at City Hall in West Allis on this date to vote on a motion to convene in closed session at said time and place, and to place to discuss performance evaluation data of public employees, executive service positions, and take such further action as may be necessary and appropriate with respect to such matter. A closed session for the above purposes is authorized pursuant to the provisions of Wisconsin Statute Section .19.85.
move to go to closed session.
We have a motion
Second.
and a second. Alderman Rowe.